Guinea-Conakry is experiencing a resurgence of the Ebola outbreak, signaling alert for sub-regional countries to tighten measures to avert another outbreak. Gambian authorities say the country would revive measures put in place some years ago to prevent the strike of the disease. More details in this report by Awanda Sise.
The Ebola outbreak that ravaged West Africa from 2014 to 2016, killing thousands of people, mostly in Guinea-Conakry and DR Congo, has found its way back. The contagious disease is deadlier than the current global coronavirus pandemic. As the world is faced with the coronavirus pandemic, the Gambia intends to revive structures in case it encounters the Ebola outbreak.
We understand that an outbreak occurred in Guinea and not only the Gambia, almost most of the countries in the region currently have preparing themselves. And for the case of the Gambia, this is not the first time. It could be recalled some 5 years ago, about 5 years ago. Ebola actually broke out in West Africa, and the countries that were mostly affected were Guinea, Sierra Leone, and Liberia. And thank God, Gambia didn't report any case then.
When the disease first broke in West Africa, other sub-regions put stringent measures in place to prevent the virus infection. The Gambia's Deputy Director of Health Promotion, Sanjali Traveler, says the country is aware of the resurgence and are cautious of it.
And the plan is already there because the plan we had during that time it can still be revived. We can review it. So we already have the plan, and it can also be recalled during that time some of the health workers were trained, so we only need to refresh their memory just to retain them. So meaning that I think we had that opportunity during that time, so all the available resources we had during that time can just be reviewed and updated. So I think we still have that opportunity.
Although Gambia has never experienced the Ebola outbreak, but stringent and preventive guidelines were observed. People were compelled to observe personal hygiene in public places, such as frequent washing of hands, avoiding close physical contact with people showing symptoms of the disease, among others. The 2014 to 2016 Ebola outbreak in West Africa began in a rural setting of Guinea and spread across the country within weeks, and later became a global epidemic. The outbreak ended with more than 28,600 cases and 11,325 deaths. The resurgence of the disease found Guinea battling with the COVID-19 pandemic, but response measures have been initiated, and the World Health Organization is supporting the country with vaccines to contain its spread. Reporting for iAfrica News, I am Daisy Sise.
And from that report by Ndai Sise,